Good afternoon, everyone. Thank you for joining us today. As Sean mentioned, I'm currently supporting Grand Erie Public Health following Dr. Locke's passing. I will be providing an update on the measles situation in the Brantford, Brant, Haldeman, Norfolk area today. The Grand Erie region continues to be in a measles outbreak, and there is evidence of community transmission. New cases continue to be reported to Grand Erie Public Health. However, we recognize there are likely additional cases that are not reported. Cases continue to be predominantly in individuals, mostly children, who are not up to date with their vaccinations. So if you're not up to date, you are at high risk of measles. For those who are vaccinated, your risk of measles is very low. In terms of general information, as we have been communicating from the start, measles is a highly contagious airborne virus. Individuals are considered exposed to measles if they are merely in the same place as a person who is infectious with the virus for any length of time, including 2 hours after that person leaves the area. A person with measles is contagious from 4 days before to 4 days after the rash appears. A medical mask is not sufficient to fully protect against the virus. Even if you are masked and/or an infected person is masked, you can still become infected. If you have symptoms of measles or have been exposed to measles and are not vaccinated, please avoid healthcare settings, including hospitals, unless you require medical care for worsening or severe symptoms. If you do require this care, do not delay seeking support from a medical professional. But it is really important to call ahead to inform them of your symptoms so they can better prepare for your arrival and take appropriate precautions to prevent others from getting sick too. If you're pregnant, have an infant or young child at home, or if you have an immunocompromising condition, you're advised to avoid situations where you might be exposed to someone who has measles. If you've been exposed to measles, Grand Erie Public Health is asking you complete their measles exposure form at geph.ca/measles form. Completing the form will provide a risk assessment, help provide some guidance for next steps, and help to reduce the spread. Grand Erie staff are coming to update the full list of public exposure locations on their website, bchu.org/measles, as well as hnhu.org/measles. Regarding vaccination, I want to continue to stress that vaccination is the best defense against measles. 2 doses of a measles-containing vaccine provides up to 99% protection against the virus and is recommended for all individuals born in and after 1970. If you or your child need the measles vaccines, please contact your primary healthcare provider or booking a vaccine appointment at bchu.org/measles and hnhu.org/measles. As a community, the Grand Erie Public Health region is continuing to see an increase in the number of cases. It is so important to make sure that you and your family are getting the necessary vaccines to protect yourself against measles. Measles is a vaccine-preventable infectious disease. Vaccine is your and your family's best line of defense against this highly contagious virus.